Okay, well, hello everyone. Thank you for sharing your time with Sertoma Center today for our Lunch and Learn June podcast. I'm really excited to have this discussion today. So we are going to be focusing on the subject of mental health. We're going to be talking about some common questions about mental illness, how to access services, and also hearing some interesting perspectives on care, stigma, and recovery. So with that being said, I'm your moderator today. My name is Lauren Finnegan, Director of Clinical Program Services. I'm a licensed clinical professional counselor and a substance use counselor. I specialize in therapy for those living with mental illness and addictions, and I have over 10 years experience in the field providing individual and group therapy, crisis and outreach support, and clinical supervision. We also have our panel members here today. So they are truly some of the most respected mental health professionals in the field. First, we're joined by our Assistant Executive Director, Dr. Sarah Wiemeyer. Sarah is highly degreed in mental health administration. She also has specialties in providing various therapies and techniques for individuals living with mental illness and also those living with an intellectual or developmental disability. And then Kirk Hanson is our Senior Director of Community Mental Health and Counseling Department at Sertoma. Kirk has a master's degree in community counseling, specializing in school counseling, and he has a passion for outreach and crisis services. So he has been heavily involved in developing those services at Sertoma for close to a decade. Next, we have Gia Washington, our Director of Community Education. So Gia is a master's level clinical professional counselor with extensive experience providing group and individual counseling and also training diverse populations. She has trained professionals in various fields and also the general public in mental health awareness and has earned a long list of awards for her work in that area. And then finally, Ashley Shearer, our Assistant Clinical Program Manager. She is also a licensed clinical professional counselor. She has a specialty in working with those living with both mental illness and intellectual and developmental disabilities, and has a passion for helping others to achieve their highest potential in life. So I want to just extend a thank you to all of the panelists today for helping move the discussion along. And I want to let everyone know also that you will have an opportunity to ask questions today. So you can join through Facebook or Zoom. You can join on your iPad or your Android device, PC. You can also submit questions. So we have our Q&A box that you can use to ask a question. If you want your question to be anonymous, you can click the check the question mark box, and you can ask your question that way. And then at the end of the panel discussion, we will have time just to go over some of the questions. So with that, I want to open the discussion. The first question will go to Dr. Wiemeyer. So Sarah, could you begin the conversation by explaining what mental illness is and then what it means when a person has been diagnosed with a mental illness?
Yeah, of course. I guess I want to start off though by just sharing and saying that, living with a mental illness is nothing to be ashamed of. And so oftentimes, a person receiving a diagnosis it can be scary and people can be concerned about what that future means. So by having a mental illness, it's really a wide range of conditions and it can affect, a person's mood and thinking and feelings and behavior. And really mental health, all of our mental health and emotional health, it's all in a continuum. So we all go through periods in our lives where we might struggle with managing our emotional and mental health. And so I think we just need to recognize and understand it's going to be when our mental health begins to negatively affect our ability to manage parts of our day-to-day lives. That's when we might need to think about seeking some support or exploring the idea of maybe having a diagnosis or getting support for a diagnosis of a mental illness. I want to point out too that about 1 in 4 people will experience a mental illness at some point in their life. So it's very common. And when you get diagnosed with a mental illness, what it means is that we have enough information that will help point us, the people who are here to support you, your therapists and clinicians, it's going to help us point us in the right direction for approaches to provide the right support. So the diagnosis is really just a means for us to drive an effective response and to provide support.
Thank you, Sarah, so much for that introduction. I know that diagnosis is a really important piece to getting the right kind of help. So Gia, could you share next how a person could approach a loved one that they think may benefit from mental health services?
I apologize. I'm going to interject for just a second. We had to pause the recording and get it restarted. So just give me 2 seconds. You're going to hear a recording. All right. Thank you.
All right. So when approaching a loved one and suggesting that they get help, you really want to make sure that you're doing so from a place of empathy, where you're understanding how they might feel. And they may have all kinds of emotions. They may feel very vulnerable. They might be afraid. They might be worried about their outcome and also what you might think of them. And so making sure that that approach is done in a very non-judgmental way. Avoiding statements like, well, you need to do this because you're doing this or you're doing that. And using those I statements like, I've noticed that you seem to be in a great deal of distress. You also want to give them the why, like why should they participate in treatment? And in order to tell them the why, it's understanding that recovery is possible and also knowing these services that are provided by the place that you're suggesting. And so if you're saying that you're struggling in this area, but by participating in this program, one of their goals is to help you learn how to manage your symptoms. What are your goals in life? You want to get a job. They can help support you with finding employment. They can help you navigate the community. They can help you understand your illness. So kind of having that knowledge beforehand so that you're able to answer their questions. They might receive it well, they may not, but remaining calm throughout that entire process and also not having them feel that they're being forced to make a decision, but giving them a sense of power, a sense of autonomy. You might suggest it because you think that they could benefit from the services, but ultimately it will be their choice. And even providing them with options can help. Letting them know, well, just try it out for a while. And then if you don't like it, we can look for another program. We can tweak maybe the number of days that you're participating. If you notice you have a loved one struggling, you don't want to just kind of sit back and not do anything, because what they find is that people are actually more willing to engage in receiving services if someone close to them suggests it. And if they do agree to participate in services, you want to continue to support them, checking in, how's your day going, letting them know that you're proud of them because they're working towards their recovery journey. Because having that family support goes a long way in that recovery process.
Thanks, Gia. Those are really good points. I think you made a very important point about just remaining non-judgmental. It can really be challenging to suggest therapy to a loved one. So thank you for sharing that. Kirk, here's a two-part question for you. So how has the mental health field evolved from when you first began your career, and how have mental health services at Sertoma progressed over the years?
Yeah, great questions, Lauren. Thank you for asking them. So I definitely think that we continue to see a shift of services more community-based, which is really important for certain individuals to have support in their natural environments. So that's really encouraging that we continue to see a shift towards being out in the community and supporting those individuals that need that level of support. I think stigma has gone down over the last decade or so. I think having celebrities and athletes come out and talk about it openly, I think helps a lot. So we continue to see things like that that are encouraging as well. Delivery of services is always evolving, so more choices, different level of services, really meeting individuals where they are in their recovery, and having wraparound services to meet their needs at all times. Really encouraging is we're seeing much more funding from the state and federal level. So I think more politicians are really getting around and seeing the need for mental health services. So a lot of grants are available, and that's really helping those needing support for mental health. And then I think also I'm seeing more community partnerships and community stakeholders getting more involved in the mental health field, police departments, community centers, libraries, shelters, hospitals, of course. So there's really a community that's really working together and supporting those that need support in the community, and encouraging those to get support and services for mental health.
Yeah, I definitely think that the mental health field has grown in recent years, and Sertoma has really been in the forefront of providing a lot of these mental health services in our surrounding communities. So we've definitely been, seeing the progression in the field. Ashley, could you share Sertoma's philosophy on mental health recovery?
Sure. So we support individuals who are working towards their recovery in mental health. Recovery meaning that they can improve their health and well-being. So we meet our clients where they are, and we help them in reaching their personal goals. So we believe in treating the whole person. So we collaborate with other healthcare professionals, as needed to ensure the person's needs are met. So recovery looks different for everybody. Someone might need assistance with medication management, attending doctor's appointments, or running errands in the community. Someone else, it might look like talking about their relationships in their lives and understanding different things that go on in relationships, how to communicate with other people. So it does look different for each person.
That's a great response. Thank you so much for sharing that. Recovery is a big word in our field, and we want everyone to know that people can and do recover. It just looks different depending on who you are and your background and experience. So thank you for sharing. Dr. Wiemeyer, can you comment on the impact of COVID-19 on mental health?
Yeah, absolutely. I think most of us are aware that COVID-19 has actually had a negative impact on our mental health and well-being. Many people have experienced some type of loss during the last year and a half. And so, from a loss of a job, there was significant job loss, during the time. And then with that comes loss of financial stability. In many cases, people experience loss of a friend or a loved one. And so, with that comes grief. And so we're struggling to work through a lot of the grief that we've experienced throughout the last year and a half. And that takes time. So that's one area where I think COVID-19 has really impacted our mental health. I think another significant area is that we have, as a society and people, have been isolated for a very long time. With COVID-19, we all know that we had to be cooped up, and we had to, miss our social experiences with family and friends, and that's had a significant impact on our emotional health. We really rely on one another for connection and meaning, and so when we don't get that, there's a definite change in the way that we can manage our emotional and mental health. And finally, I think, one of the last areas where we've had an impact on our mental health from COVID-19 is just changes in routines. So, a lot of people have had different types of work where now you're working remote sometimes, maybe sometimes you're not. We have a lot of parents who have had to work through trying to work and also have their children, be virtual for school. And so just in our everyday routines and how we function has been significantly impacted by COVID-19. And with that is that change is hard. It doesn't come easily to us. And so trying to figure that out and manage that has caused a lot of stress. And so those are just a few of the ways, there's been loss, isolation, changes in our routines. And so, people have definitely had their mental health and emotional health impacted, and adults and youth. So all of us, really, I think it's, we hear a lot about how it's impacted negatively our youth too, and not having that socialization and the level of support they have in those routines and in the structure of going to school.
Thank you so much. Next is Gia. What role, Gia, do you think stigma plays in people's willingness to seek help?
Lauren, stigma plays a huge role in people's willingness to seek help. And Kirk, you mentioned that the stigma is starting to be reduced as more people are open about their own struggles. But unfortunately, stigma is still one of the leading reasons why people either don't seek treatment or delay treatment or don't actively participate in treatment. And so when you look at stigma, we can look at stigma two different ways, the self-stigma and then a public stigma. And so the self-stigma is how that person who is living with that mental illness views themselves. The thought that these kinds of things don't happen to people like me. I'm supposed to be smarter than this or stronger than this, or I'm the one that everybody goes to for help. How could I possibly be struggling? But the reality is that mental illness doesn't discriminate, and anybody can have their own rough patch in life, And so the self-stigma is also affected by the public stigma. That stigma toward mental health tends to be a lot more negative than the stigma toward any other illness. If someone says that they have a mental illness, unfortunately, you might hear words that that person is crazy or that person is dangerous, where they're treated as if a mental illness is synonymous with violence, and that is not the case. 95% of violent crimes are committed by people who do not have a mental illness, and that person who is living with that illness is more likely to be the victim than a perpetrator. If a person has an illness like cancer, they might be described as they're a fighter or a survivor or they're ill. Well, those are also adjectives that would apply to a person who is living with a mental illness. So that public opinion affects people's view of how, that mental illness is going to affect their life or how others might view them. Even when you think about how mental illness is portrayed in movies, in the media, the person with a mental illness is either going to be the butt of the joke or they're going to be a villain. And those false perceptions have people thinking that that's what mental illness looks like. It does not present the spectrum of mental health challenges. It does not promote the message of recovery. And a lot of the stigma is really just coming from misinformation. And it's misinformation because we don't talk about mental health. So conversations like this are so important. Community education is so important. I'm looking forward to us really being able to present mental health as just a part of overall health.
Thank you, Gia. I also want to emphasize today the availability of resources, and that resources are key in getting the help one needs. So with that, Kirk, what are some available resources in the surrounding communities and at Sertoma that people can access who are experiencing mental illness or even a crisis?
Yeah, great question, Lauren. I think the first step is typically to get assessed, to get clarity if you do have a mental health diagnosis. And then going from there, there are a lot of support and services. Obviously, at Sertoma, we provide individual therapy, which is usually a first step. Obviously, there's a lot of other services. Psychiatry is an option. Depending on the severity of the mental illness, hospitals or nursing homes might be an option for someone needing a little bit more support. There's a lot of community-based support as well, so case management. We have a team that will visit people in their homes and support them with independent living skills and making sure that they're going to the grocery store or opening up a checking account or advocating and learning how to talk to a landlord or just going to the local grocery store or the library and getting a library card. These are some things that we can provide support with, and the support is out there. One thing I did want to mention is that the government recently passed a law to have a national suicide hotline, which will be 988, which is great news. So I think that's really encouraging that that everyone knows that number, and it's kind of like a 911 number, and it's really familiar with everyone. So I know that Illinois is working towards rolling that out. It's in process, so Sertoma will be involved with that on some level. But the idea is if someone calls the 988 suicide hotline and they need immediate support, there'll be a mobile crisis unit that can provide support if needed, and also be collaborating with police departments. So we're seeing a lot of programs evolve and more services available. Obviously, there's employment services and assistance services for individuals that need more homemaker or a personal assistance if they need home support. So a lot of great support and services. I think the first step is getting assessed and kind of getting some clarity if you do have a mental health diagnosis, and then going from there.
Thank you, Kirk. So I also wanted just to verify, so the suicide hotline will be 988. So I've included that in the chat box here as well. And, we can make sure that everyone listening has access to that number, 988, if they need it. And as Sarah mentioned, these are really challenging times we're living in right now, especially with COVID-19, and also for families in particular, with everything that they're encountering with school closings and, job loss and losses in their families. So Kirk, how can Sertoma help families in particular or youth who are going through depression and anxiety during these times?
Yeah, it's been a difficult time for schools and also for children and adolescents in schools. It's been a huge change, and there's been a lot of adjustments. And so Sertoma's here to help. We're trying to work with schools actually actively right now. We believe psychoeducational groups are really helpful for children and adolescents to understand and learn about mental health diagnosis. The coordination with schools is really important as well. Community-based services, as I've mentioned a lot, I find that that's really effective for certain individuals. Education and literature, openly talking about it in the schools is important, whether it's in the health class. I mean, health classes should be part of that. So hopefully schools are evolving. Obviously, groups are helpful. Play therapy is helpful. So I think groups are really helpful for children and adolescents, knowing that they're not the only person, experiencing a mental health diagnosis. And then I think the pharmacology interventions could be an option as well, if needed. So there's a lot of options and support out there. I think just having the conversation and making it more open dialogue, I think, is really important in schools.
Thank you. Also, just a quick follow-up on one thing you mentioned. So you talked about pharmacology. So for those who may be unfamiliar, can you maybe explain what does pharmacology mean? And then how would somebody go about finding out if that's something that's needed for them or will help them?
Yeah, so pharmacology interventions essentially means that a psychiatrist has, prescribed medicine to help with the mental health diagnosis. So, an example would be the antidepressant or something to help with anxiety. So it's medicine essentially.
Thank you. So the next question is for Ashley. So Ashley, can you describe what mental health treatment and counseling looks like? So, this might help somebody who might be afraid or a little bit unsure about following through with treatment.
Yeah, so counseling is typically with someone who has a background in counseling or social work. People can expect to work with a therapist that's going to help them sort out their feelings. Kind of like I said before, work towards a goal, help build positive relationships in their lives, sometimes just sort out life events. Like we've mentioned, a lot has happened this past year. So just sorting through those feelings and those experiences. A lot of people describe counseling as just a very non-judgmental, like helping hand. Sometimes when we go to our family and friends, they might give us good advice, but we still are left feeling like we need something else or we need to still figure something else out. So a lot of people say that non-judgmental person is just there to help you sort through those things. And one thing I'd like to emphasize is that for someone who's looking for a therapist, it's typically just like a doctor. So if you feel like you're not jiving with the person that you've picked or that you were placed with, please advocate to maybe see somebody else. I think I know all of us here and most therapists would say that's okay. If we don't fit, then you definitely should find somebody that is going to help you reach your highest potential.
That's a great response. Thanks, Ashley. And then for Sarah, I have a question. Where do you see the mental health field going in 5 years from now?
That's a really good question, Lauren. I have certainly a lot of hopes about where I'd like to see the mental health field going, and I think we're taking some steps towards some of these hopes. But I guess the first thing is that mental health services, right off the top, it just needs to be more widely available and widely accessible within our healthcare system. So I think Gia kind of mentioned our healthcare system before when talking about stigma, and part of this is just that mental health needs just to be an everyday part of our healthcare system. And so I think that's happening. People might have noticed maybe last time you were at your doctor's appointment, they maybe did a screening for depression or asked you a few questions. I've heard someone mention recently they actually, there was some screening for domestic violence at a primary care doctor's visit. So those are good things that are happening. So, we want to see that part of our mental health is also addressed within our whole health system. And when I say widely available and easily accessible, I mean, I'm glad that we're providing some resources for people today, but, it's still challenging sometimes to know where to go and how to find a counselor and, how many visits will your insurance company authorize? And so there's been definitely some steps taken by insurance companies, providing more access to mental health services too. But that's really one of the things I'd like to see in 5 years is that it's very easily accessible to go address your mental health. And part of that, I think, is just the idea for us personally too, is that we've talked about reducing stigma and providing education around mental illness and about, the opportunities to get support and, live a hopeful life in recovery with a mental illness, that people feel more strongly about advocating for themselves in their mental health services as part of the whole health system. So just like I think about taking care of my physical health, and I also hope in 5 years people are thinking proactively about taking care of their mental health and addressing their mental health just as much as their physical health. And so I'm hopeful that people are speaking more and more openly about their mental health, and Kirk mentioned that before. So I think that we are seeing a shift towards people having a better understanding about the importance of addressing mental health services and seeing maybe less stigma and more people seeking support, and then that support being accessible. So that's where I hope we get to in 5 years, and maybe sooner would be great.
That would be great. Thank you so much, Sarah. So I think this panel has been extremely knowledgeable and informative today. So hopefully the audience has been able to learn a little bit more about mental health and also gain some helpful resources too. So with that, I want to take some time to address any questions we have from our viewers.
So currently, we don't have any questions that have been submitted, but I have a question myself. So I have a teenage son who during this shutdown has had a lot of struggle. And so we found a therapist for him, but it was tough. We were trying to figure out how to find a therapist that he could relate to as a 15-year-old. And so I don't know if you have any tips for parents that maybe you can share about. I know we touched a little bit on about, finding a good fit, but maybe you can share some tips on like even how to start the process of knowing if you should seek therapy for your kid, for your child.
Anyone want to
Okay.
take this
Go ahead,
question?
Lauren, you can answer.
I'll answer. I think that and then anyone can respond additionally, but I think that it can be challenging initially seeking therapy, starting therapy, because you aren't sure about this person that you're opening up to, and especially for a teenager who is going through a lot of transitions in their lives and may not feel or be sure if this therapist can relate to what they're going through at that stage in their life. So, I would just say that really it takes a lot of bravery to seek treatment and follow through initially, but then once you do, that therapist is just going to want to get to know you and what you're dealing with, and just figure out, what do you want the first step to be? What do you want to talk about? They'll listen. So the rapport building in the beginning is really, really important. And then I think over time, I've seen people who didn't trust their therapist initially, like slowly build trust and open up about a lot of things that have really helped in their recovery. So we do have a lot of therapists on staff who, on our staff, who are really, approachable and when it comes to working with the teens and youth, and just really have a passion for that. And can do all sorts of things. I've seen therapists play games to build rapport. I've seen them listen to music. So we can really incorporate anything needed. So I would say that that's the first step, is just building that relationship.
I just wanted to add too, as a parent, seeking services, you have the option to interview the therapist and research the therapist just as much as they're going to be doing with, with your child as well. So, thinking about things like, do you think your son or daughter would do better with a male therapist or a female therapist? Those are some choices that you can make. Oftentimes therapists will have profiles online too, and you can read a little bit about, they have experience working with teens, they have experience working with adults with substance use disorder. So you'll sort of see some other areas of specialty too. So you'll want to look for things that connect with you, even just in reading their profiles. And then of course you have an opportunity, an initial call to set up an appointment to ask them some questions too about their experience working with maybe certain features or of your son or daughter, or maybe certain characteristics. So those are all things that you can do up front, and maybe asking, if you're getting some buy-in from your child as well, and asking them, what kind of person would you like to talk to? Who would you feel comfortable talking to? And asking them some of those questions too. So, you do have a choice, and there is information out there. Oftentimes your insurance company will give you, a list of providers in your area, and you can find a lot of information usually on their websites about that provider and a bio.
I wanted to also share that Psychology Today is a good resource. You can search your where you live, and it can provide all the counselors typically in your area. And then, like Sarah was mentioning, there's a bio there, and really looking at specifically what you're looking for, and it's pretty detailed, so that's helpful.
I would also suggest explaining to your child what therapy might be like for them. Letting them know that this is a space that they can go and they can say whatever they want to say. Also letting them know the limits of confidentiality, but not having them think that it's you and the therapist working together and they're kind of on their own, but that this is their therapeutic process, that they're the one in control of that therapeutic process. And so that they can be as open, they can be as honest with that therapist, because that's how they're going to get the most out of that session.
Thank you. Again, please feel free to share any questions you may have. And again, we'll be sharing the recording later. So if you missed maybe the beginning, you can go back and rewatch it. We will also be posting an opportunity to submit questions later in case you would think of something. And Facebook Live, welcome everybody that has been joining us. We have about 10 participants, and a couple of people have been giving shout outs, and we appreciate that. They're saying thank you for the honesty and resources that Sertoma provides and for doing all that we do. So thank you. That really, helps. The support of our community really helps. We're all in this together. I guess we'll give one more, couple more seconds if anyone thinks of a question, but it sounds like, we just have someone that just posted a question. I have a family member that wants to have an intervention of sorts for someone they think should look into services. I feel that's very confidential. Any thoughts?
Can you say that one more time?
Okay, sorry about that. They have a family member who wants to have an intervention for someone they think should look into services or treatment. I feel that's very confidential. And they're just wondering if you have any thoughts about that. Like if you have a family member who you think should seek services, but maybe isn't, you're observing it, but they haven't really come out and admitted that they need services, I guess is where the question is coming from.
Gia kind of discussed that earlier, so I'm guessing she's going to jump in here in a little bit too. But just to open that up, I think the first part of that question that struck me that was confidential is, really you approaching anybody with any concerns that you have about what you've observed, that's definitely not confidential. So as long as if you're having an intervention and you're sharing about how you feel about how someone, may be impacting you, or what your concerns about someone, that's totally appropriate to do at any point. So I definitely encourage it. It's going to be that person's choice in the end about, what direction and what steps they take. But I would definitely wouldn't be concerned about any kind of confidentiality around just approaching someone with any concerns that you might have, and showing them that you care about them and that you love them and that you want to see them be successful and have the best life that they can have.
Thank you, Sarah. And that's a great perspective on confidential, but this is a great example of when automatic spell check or whatever jumps in and they apologize. They meant to type in confrontational.
And that's actually, I'm glad that they typed in confrontational, because that is one of the risks with intervention. So they're kind of getting away from doing a lot of the interventions where you have that person surrounded by a room full of people. if anybody walks into a room full of people, it is really easy for your defenses to come up, for that wall to come up, and for you to shut down because it can feel like you're being judged. My preference would be to have a one-on-one conversation with the person where you're pointing out what you've observed and just listening to them. Let them tell you what their experience is, what their concerns are, what they're willing to do. The bottom line is we need that motivation to be that intrinsic motivation as opposed to I'm telling you that you have to go to receive treatment, because they need to understand the benefits and be willing to actually work that recovery program. You know, they need to be able to participate. They need to know that there's a benefit from them doing so. And so taking that time and being patient with them. If they don't agree to it immediately and they're not in crisis, look at it as maybe what you're doing is you're planting a seed, and maybe they're going to think about it. And they may come back to you and they may ask more questions. So you may take another opportunity to talk to them about it again. The average delay between people, when people first start to struggle with symptoms of mental illness and when they get help, is 10 years. So it isn't uncommon that people don't just automatically jump and accept the help that's being offered. It's being patient, being consistent, and being open, and not getting mad, but understanding that it really does have to be their journey. As much as we want it for them, they kind of need to want it for themselves as well. They may not realize it due to symptoms. And so you kind of might have to be a little bit more directive, but you're still going to do that with that empathy and with that compassion and with that patience.
Thank you, Gia. Someone else on Facebook Live pointed out a good point, that maybe speaking with the family member's general practitioner, their doctor, about your concerns, and then maybe they can speak with the family member to see about what a best approach to take. We have not had any more questions, so Mary did submit something. As
Yeah,
a therapist,
Mary-
do you see it on the chat? Okay.
Yeah, she gave some good feedback on her experience working with youth and how she invites the parent or guardian to join for sessions to discuss the role of the therapist and some general guidelines and confidentiality, but also the rights of the client. So like we said, they're guiding their own treatment, and just empowering the youth to do so is really important. Thanks, Mary.
I think that's a good point with that other person mentioned with the seeing your primary. Sometimes if you see significant mood changes, there could be a medical condition that's not diagnosed as well that's changing some behavior. So I think that's a good place to start.
That is a good point. And also I wanted to add just my own observation that I've noticed doctors are really emphasizing mental health a bit more than they have in years past, doing the depression screenings and asking some questions about anxiety, talking about, how you take care of yourself. And so, that may be a direction to go if you are suspecting mental illness or concerns with one of your family members or even yourself.
Yeah, and also if a family member, has someone in their family that they're worried about or concerned about, sometimes that family member can get therapy themselves, and that might be a good option for that individual to get therapy, and maybe they can get some different perspective and some support that way as well, and how to support that individual. So that might be an option.
And just back to the primary healthcare topic too, they do say that, obviously people are much more likely to see their primary health, doctor, especially for, first time, issue than a therapist. But just also to keep in mind, the primary health doctor's role is really going to be to do screening. And from there, that's where their scope of practice ends. So they will do a screening and then they would refer out. So I just want to make it clear that that's not their scope of practice too. So, they'll be providing some very preliminary information and then referring out.
Also too, information was also shared about, I think this goes back to the question about finding a therapist for your teenager, but NAMI offers it's NAMI.org/basics. And I'll share that on our Zoom as well. But they offer a free online class for families to learn about mental health for children 4 to 21 years old. Very good information. Thank you for sharing that.
NAMI is a great resource and a great partner of Sertoma as well. We work very closely with NAMI, and so I would absolutely refer people to check out the resources they have to offer.
Also too, someone pointed out, Mary pointed out that their child's pediatrician is doing mental health questions at appointments too. So that's good. I think it's starting to get into where we're aligning all these medical fields, because it's treating the whole person.
And just to mention too, with that, we often talk with people about addressing, in order to have good mental health, you have to have good physical health, and vice versa. So it really is about whole health at this time. And I'm glad to hear that people are experiencing this within their primary care practices. But, we do have a lot of those conversations too about how your physical health can impact your mental health, and how your mental health can also impact your physical health. So they do go hand in hand, and it does take a collaborative process.
Anyone, last call for questions? We're on about 12:40, approaching 12:45. We want to be cognizant of everyone time. So if there's any last questions, let us know. And we don't seem to be getting any. So, Lauren, do you want to kind of wrap us up for today?
Sure. I just want to thank everyone again for viewing our panel discussion today and participating. And, hopefully you gained, some interesting perspectives and knowledge, and, maybe you can use that to help yourselves or help others in your life and with mental health, and just continue to increase that awareness. So I know that we are wrapping up, but we are going to make this panel discussion available on our website. There will also be an option to submit additional questions if you think of something after this point that you want to ask until early next week. And I do believe, and Susan, you can correct me if I'm wrong, but I believe that it might be available also on our Facebook page after this, or the website.
Yes, we're going to put a link on the homepage of our website, which is sertomacenter.org, and on our Facebook page. And I'll update the event, the information within the event with a link to our Facebook page, just to make it easy on everybody.
All right. Well, thank you all for your time today.
Thank you. Thank you for your
Thank you.
questions.
Thank you.
Your time.
Thank you.
Bye.